Hello everyone, I am Shomukantigiri. Welcome to my channel. So in this video we will discuss about 10 important MCQs on anticholinergic drugs. Okay, we have already uploaded a video on top 10 MCQs regarding cholinergic drugs. Okay, I am giving the link of that video in the I button section. Please have a look. Okay, so this is my brief introduction. Let's jump into the topic. Okay, so first question is belladonna poisoning may occur due to drug overdose or consumption of seeds and berries of belladonna plant. Thus, that poisoning can be overcome by. Okay, that means the question is asking about the what is the antidote of belladonna poisoning. Okay, ये GPAT 2016 का क्वेश्चन है. Options are homatropins, digitoxin, cinchonidine and physostigmine. I hope all of you know that physostigmine is the drug of choice in case of belladonna poisoning. Okay, let's have a look. Conditions and drug of choice. This image I have taken from review of pharmacology Spars Gupta. Okay, so in case of mushroom poisoning, two types of mushroom poisonings are there: early mushroom poisoning and delayed mushroom poisoning. Okay, atropine is the drug of choice in case of early mushroom poisoning, whereas theotic acid, okay, is the drug of choice in case of delayed mushroom poisoning. Okay, in case of glaucoma, open angle glaucoma, latanoprost is the drug of choice. We have discussed in the previous video what is latanoprost. It's a prostaglandin analog, and what is the role of what is the mechanism of action. Okay, so angle closure, in case of angle closure glaucoma, acetazolamide, a carbonic anhydrase inhibitor, that is the drug of choice. Okay, in case of myasthenia gravis is diagnosed by hydrophonium. We have discussed already this in early video. Okay, treatment. The treatment of myasthenia gravis is done by neostigmine. In case of belladonna poisoning, physostigmine is your drug of choice. In case of atropine poisoning, physostigmine is your drug of choice. Datura poisoning, physostigmine is your drug of choice. So in these three conditions, physostigmine is the drug of choice. Okay, you have to keep in mind this drug of choice list. Okay, Alzheimer's dementia, donepezil, cobra bite. In case of cobra bite, we use antivenom. Okay, anticholinergic poisoning, in case of anticholinergic poisoning like organophosphate carbamate poisoning, we use atropine plus pralidoxin. Okay, then coming to the next question, to obtain a more effective bronchodilation, the drugs that are combined along with beta receptor antagonists are. So options are cholinergic antagonist, cholinergic agonist, beta receptor antagonist, alpha receptor antagonist. Ipratropium bromide, okay, ipratropium bromide, tiotropium bromide, all of these are cholinergic antagonist. Okay, cholinergic antagonist. So your answer will be option A. Actions of anticholinergic drugs on the respiratory system. What are the actions? Anticholinergic drugs reverse the bronchoconstriction caused by stimulation of M3 receptors. In the previous video, we have discussed about M1 receptor, M2 receptor, and M3 receptor. All of these receptors are G protein coupled receptor. M2 receptor present in heart, M1 receptor present in gastric gland, okay, and M3 receptor present in eye and smooth muscle, and in your bronchus. Okay. So anticholinergic drugs reverse bronchoconstriction by blocking M3 receptor. Ipratropium bromide, tiotropium bromide are muscarinic receptor antagonists useful in the treatment of COPD and bronchial asthma. So the answer will be here cholinergic antagonist. Okay. Coming to the next question, atropine produces following actions except. It's a very important question. Okay. Options are tachycardia, mydriasis, dryness of mouth, urinary incontinence. C. Atropine causes tachycardia. Atropine also causes mydriasis. It also causes dryness of mouth. Atropine, how it causes tachycardia? It inhibits M2 receptor. It blocks M2 receptor. M2 receptor present in heart. When it blocks, when atropine blocks M2 receptor, then heart rate will increase. Okay. So in case of mydriasis, atropine also causes mydriasis, and it's a potent cyclophagic. It has potent cyclophagic action and mydriatic action. Okay, it is also longest acting mydriatic agent. So mydriasis is occurred by atropine. Dryness of mouth. All anticholinergic drugs causes dryness of mouth. So here option will be urinary incontinence. Okay, atropine does not produce this effect. So let's study some basic facts regarding atropine. What is the source of atropine? Atropine is a tropane alkaloid and is an anticholinergic medication, is an anticholinergic drug synthesized from Atropa belladonna. Atropa belladonna family is Solanaceae and atropine is a tropane alkaloid. Okay, it's a very important. It's a racemic mixture of D and L hyoscyamine. Effects, see on CVS it has tachycardia, it can produce tachycardia due to the blockade of M2 receptors. Postsynaptic M2 receptor is blocked by atropine, that's why it can produce tachycardia. Tachycardia means heart rate will be increased. In case of eye, atropine is a potent mydriatic agent and cycloplegia action it can produce, and the action lasts about 7 to 10 days. On respiratory system, atropine causes bronchodilation. Okay, atropine causes bronchodilation and reduces airway resistance. On urinary system, atropine has relaxant action on urinary bladder. Atropine has relaxant action on urinary bladder. That's why urinary retention can occur. So here the option D is talking about urinary incontinence. That is opposite to the urinary retention. So this will be your answer in that particular question. Okay. In case of CNS, atropine has overall CNS stimulant action, whereas hyoscine has CNS depressant action. We will all understand this in the later part of this video. Okay. Coming to the next question, drug of choice for smoking cessation. Very important question. Okay. Varenicline, duloxetine, acamprostate, and chlorodiazepoxide. See, your answer will be varenicline. Okay, it has been taken, the question has been taken directly from the KD Tripathi. Okay, here you can see that varenicline is the drug of choice for smoking cessation and it's a FDA approved drug. Okay, it's a nicotinic receptor agonist and type of nicotinic receptor is alpha 4 beta 2 type of nicotinic receptor. It agonist alpha 4 beta 2 type of nicotinic receptor, and that's how it can cause smoking cessation. Okay, and it's a FDA approved drug. Coming to the fifth question, shortest acting mydriatic agent. Shortest acting mydriatic agent means, what is mydriatics? Mydriatic means they actually increase the diameter of the eye. Actually, eye opening is increased for the experiment of the posterior section of the eye, like retina. If you have to observe your retina, then your diameter of the pupil, your diameter of the eye should be increased. Okay, your pupil will be relaxed condition. Pupil will be in relaxed condition. Then only you will be able to observe your posterior portion of the eye. So shortest acting mydriatics are, which of the following is the shortest acting mydriatic agent? Examples are homatropine. Options are homatropine, cyclopentolate, tropicamide, and atropine. See, atropine is the longest acting mydriatic agent, whereas tropicamide is the shortest acting mydriatic agent. So here answer will be tropicamide. Coming to the basic features regarding mydriatic agent and all. So anticholinergic drugs causes mydriasis and cycloplegia. Okay, atropine, homatropine, cyclopentolate, tropicamide, these are used as mydriatic agent. Mydriatic action is useful in fundus experiment. Okay, so in that particular experiment, your eye opening should be increased and the doctor can easily visualize the retinal portion. Okay, so atropine has a very long duration and it is the longest acting mydriatic agent, whereas tropicamide is the shortest acting mydriatic agent. Okay, this is a factual question, so you have to remember all these things. Next, coming to the sixth question, hyoscine differs from atropine in that it's a very important question. Okay, the difference between hyoscine and atropine. The question is asking about the difference between hyoscine and atropine. See, the options are exerts depressant effect on CNS at relatively low dose, exerts more potent effects on the heart than on the eye, it is longer acting, it has weaker anti-motion sickness activity. That means hyoscine exerts depressant effects on the CNS at relatively low dose. Yes, it is obviously correct, absolutely correct statement. Then hyoscine exerts more potent effect on heart than on eye. No, it's a wrong statement. Hyoscine is longer acting than atropine. No, it's also a wrong option. Hyoscine has weaker anti-motion sickness than atropine. No, it also false. So these three statements, option B, option C, and option D, these are false, and option A will be your correct answer. Let's understand the difference between the atropine and hyoscine in brief. Okay. See, the chief source of atropine is Atropa belladonna, Datura stramonium. These are the chief source of atropine. Whereas in case of hyoscine is obtained from Hyoscyamus niger. See, these three your plants comes from Solanaceae family, and all of these are having tropane alkaloid. Okay, so alkaloidal ester which is present in case of atropine is tropine, and in case of hyoscine it is scopine. CNS effect. Atropine has excitatory, that means CNS stimulant effect, atropine has, whereas hyoscine has CNS depressant effect. Anticholinergic property, both of these two are having anticholinergic property, but atropine is more potent on heart, bronchial muscle, and intestines, whereas hyoscine has more potent action on eye, okay, and secretory glands. Duration of action, atropine has longer duration of action, whereas hyoscine has shorter duration of action. Anti-motion sickness, see, atropine has lesser amount of atropine can produce lesser amount of anti-motion sickness than your hyoscine. Okay, so your answer will be in this particular question, your answer will be option A. And if you don't understand the difference between the hyoscine and atropine, then you can't able to solve this question easily. Okay. Coming to the next question, which of the following anticholinergic drugs is primarily used for pre-anesthetic medication during surgery? It's also an important question. Which of the following drugs? Options are glycopyrrolate. See, glycopyrrolate will be your answer. Okay, no need to read out other options. Okay, so you can pause and read out the other options, but your glycopyrrolate will be answer. But why glycopyrrolate is used in case of pre-anesthetic medication? See, because it's a potent and fast-acting drug. It has no central action, that is very important, and it has anti-secretory and vagolytic action. That's why glycopyrrolate is being used in case of pre-anesthetic medication. So, okay. So, in this video, I am not discussing the answers. I am also explaining the answers, why they are these options are correct, why these are not correct. Okay, so you have to understand all of these. Coming to the next question, choose the relatively vesicoselective anticholinergic drugs used for urinary frequency and arch incontinence due to the destructive muscle instability. That means when a patient is having a syndrome like urinary frequency, मतलब उनका यूरिन ज़्यादा हो रहा है, उनका यूरिन का जो फ्रीक्वेंसी वो बढ़ गया है, मतलब वो इंक्रीज हो गया है, ठीक है, तो इन दैट पर्टिकुलर केस यू विल यूज वेसिकोसिलेक्टिव ड्रग्स. Okay, so which of the following comes under the vesicoselective drug? Options are pyrenzepine, oxybutynin, oxyphenonium, and glycopyrrolate. See, glycopyrrolate will be not your answer. Here, oxybutynin will be your answer. Okay. Coming to the detail of the vesicoselective drugs. See, oxybutynin, flavoxate, and tolterodine. These three are your vesicoselective drugs. So coming to the oxybutynin. Oxybutynin is the newer muscarinic drug, has higher affinity for receptors in the urinary bladder and salivary gland. It is relatively selective for M1 and M3 subtype. Okay, and in case of destruction muscle, your M3 receptor is present there. If you can block that particular receptor, M3 receptor is a GPCR receptor, and GQ protein coupled GPCR receptor, M3 is a, okay. If you can block M3 receptor, then IP3 DAC pathway will not happen, and that means calcium will not be released. If calcium is not released, then vasoconstriction will not occur. Okay, so vasorelaxation will be there. Okay, so oxybutynin acts through this. Okay, it is used in destructure instability. Tolterodine, it's also like activity like oxybutynin, and it's a selective M3 muscarinic antagonist. Okay, and preferential action, it has preferential action on urinary bladder. And all of these vesicoselective drugs like oxybutynin, flavoxate, and tolterodine, they're all used in case of urinary bladder hyperactivity, in case of urinary frequency and urgency. All of these drugs used in that particular case. Then coming to flavoxate, it has similar property to oxybutynin, and it is also indicated in urinary frequency, urgency, and dysuria. Okay. Then coming to another important point, darifenacin and soliferacin. These two are the selective M3 receptor antimuscarinic drug. I am repeating that M3 receptor is present in your bladder, urinary bladder, and it's a GQ protein coupled GPCR. When this receptor is activated, then IP3 DAC pathway will be open, and that particular pathway will lead to release of calcium. If calcium is released, then vasoconstriction will occur. But if your M3 receptor is blocked by flavoxate, oxybutynin, and other, then this particular pathway will not be happening, and calcium can't be released from the sarcoplasmic reticulum. Then what will happen? Vasoconstriction will not come into the picture. So vasodilation will occur. Okay. So flavoxate, oxybutynin, and your tolterodine, these acts through this particular mechanism. Okay. Then coming to the ninth question, choose the correct statement about drotavarin. It's also a very important question. It's a smooth muscle antispasmodic acting by non-cholinergic mechanisms. Okay, absolutely correct statement. Then it's a papaverine congener and used in peripheral vascular disease. No, it's a wrong statement. It is a synthetic atropine substitute. No, it's not a synthetic atropine substitute. It's a M1 M3 selective antagonist. No, drotavarin, it's not an anticholinergic drug. Drotavarin is a novel drug which is non-anticholinergic. Okay, and it's a smooth muscle antispasmodic drug, acts through inhibiting phosphodiesterase 4 enzyme inhibitor. See how drotavarin works. Drotavarin can increase the concentration of CAMP in your body. Okay, and there is an enzyme phosphodiesterase 4 which is responsible for degradation of CAMP. Okay, drotavarin actually inhibits this phosphodiesterase 4. So amount of phosphodiesterase 4 will be reduced in your body, and amount of CAMP will be increased in your body, and this particular CAMP will create vasodilation. Okay, so drotavarin acts through this mechanism. Okay, and it is used in intestinal, biliary, renal colitis, irritable bowel syndrome, and uterine spasms. Okay, and it has very minimal amount of anticholinergic side effects. Okay, remember drotavarin is not an anticholinergic drug. Okay, coming to the last question of today's class. Inhaled ipratropium bromide has the following advantage except. Options are: it does not alter respiratory secretion. Yes, correct. It does not alter respiratory secretion. It does not depress airway mucociliary clearance. Yes, it is also correct. It does not depress airway mucociliary clearance. And it has faster onset of bronchodilator action than inhaled salbutamol. No, it is wrong. Because the peak comes later in case of ipratropium bromide. Okay, and it only rarely produce systemic side effects. Yes, it is correct. So in this particular question, they are asking about except. What is not the advantage of ipratropium bromide? So your answer will be option C, because ipratropium bromide does not work faster than salbutamol. Okay, salbutamol works faster than ipratropium bromide. So that's why your option C will be right answer in this particular case, as it is not the advantage that provides by ipratropium bromide. Okay, so today I am finishing the class here. Okay, I hope all of you like the video. Please like, share, and subscribe our channel. Thank you.